working on beginning stages of an ACL compromise with meniscus issues. The beginning stages are going to cover post-op all the way up to weight bearing. Should probably be about 3 days to maybe 2 a week. It's going to focus on passive range of motion. We want to stay away from active range of motion as the joint will still be tender from surgery. The general muscle contractions are going to be isometric, not going through the range of motion as well, just staying away from that post-surgery. I'm going to be the patient and John will be the clinician.
So post-surgery, we'll be working the athlete to passive flexion and extension. So what we do is we do sets slightly, slowly, putting him in flexion as far as he can go passively, and then working. So post-surgery, the athlete's leg is going to be slightly flexed as so. So what we're going to be doing is passive negative extensions. What I'm going to be doing is slightly pushing on the legs of the athlete into full extension. And what it's probably going to hurt a little bit, but I'm not jabbing it down, slowly forcing it downward in full extension. It'll probably come back up, like, because it's raw. So I'll just keep pushing it slowly into full extension and just do that as sets. Just trying to work full extension. So I'm going to have the athlete work on quad contractions or quad sets. What they're going to do most likely post-surgery, the quad's going to be in atrophy. So what we're going to be doing is working on getting it to be able to fire again. So if I look at the athlete and they can't get it to fire, so try to contract, you can't do it, I'm going to help try to get the sensors going, and they're going to keep contracting. They're going to do sets of that to try to help strengthen back your quad muscle. I'll be helping my athlete or patient do heel slides. So what I'm going to want you to do is just put your leg up, flat leg up. Alright, so it might hurt a little bit, but you got to work through it. What you're going to do is you're going to bring your leg back as a flexion as far as you can, and then you're going to slide it back out. Okay, and you're going to keep doing that. We're going to heel slides. And after you do sets of that, you're going to modify it. You can put a towel around underneath your foot. Okay, and you're going to pull yourself into farther range of flexion, forcing your leg farther back. And it'll help. It helps you after you can't do it as much passively as you can do. Alright, so beginning stage rehab, we're going to work prone hangs here for ACL injury with meniscus tear. Since when they have surgery coming right out, their leg will probably be here, so we're going to be working with gravity to kind of help get it back to full extension, and working with gravity to help that out. Prone hangs. Post-surgery, we're working isometric knee extension. What we're going to have to do, athlete do, is we want him to fire everything in his knee with a hard contraction with limiting the range of motion. So what we do is have a non-elastic band around his ankle, and what he's going to do is he's going to extend his leg out, firing everything in his knee without it actually moving. Hence isometric. We're going to do this for sets. Good. Alright, so post-surgery, we're going to have them working isometric knee flexion. What we're going to be doing is put the heel against the table, and we want a hard contraction in the knee as well, without the range of motion, but they're going to be pressing against the wall, firing everything in their knee, but with a limited range of motion. Well, actually, should be no range of motion, really. Do this for sets. So another exercise we can do post-surgery is I'm going to have them do straight leg raise. So you're going to dorsiflex your ankle, you're going to fire your quad, or you're going to connect chain lifting your leg up. Okay, and you're going to be doing sets of this. Alright, so post-surgery we'll be working on assisted weight shifts. What they're going to do for safety reasons, put their hands on the table. That way they don't fall and hurt themselves even more. What they're going to do is they're going to shift their weight onto the injured leg, getting used to having weight on it and firing the muscles with their own weight. Weight shifts. Assisted. So we're working for rehab for an ACL injury with meniscus tear. We're going to work range of motion in the patella. So patellar mobilization, we're going to be moving it, working range of motion laterally, slightly moving it, and medially, trying to get some movement inside of there. Just working range of motion. So post-surgery, we're going to have the athlete working passive hamstring stretch. So what they're going to do is they're going to take their cord or TheraBand, whatever they have available, the clinician, grab it around their foot, and the athlete's going to grab their band or rope, and they're going to passively work themselves, keeping extension, and they're going to be stretching the hamstring.
Where are you taking?
Passively, and they're going to do this for sets. Keeping extension. So now we're starting the intermediate stage of the rehab, and this is all basically focused on getting from weight bearing all the way to 85% strength. And where all it is since now we have pretty much full range of motion in the joint, we're going to be strengthening since possible muscle atrophy has occurred. During this process, Mark will be the instructor and I'll be the patient, and you'll see it.
First exercise we're going to be doing for the intermediate stage is going to be a stationary bike. Stationary bike is good because it works beneath the full range of motion, and you can use the arms to actually help you do that, and it's also good for cardio and warm-up. This exercise we're going to do for the intermediate phase is just going to be working on single leg stances, getting the leg used to having the full amount of body weight onto it. So you're going to have the athlete stand on both feet, and then you're going to gradually rotate to the bad leg. Once again, just getting the body used to having that kind of weight on the repaired ligaments. Slow down. So the next exercise we're going to be doing in the intermediate phase is going to be ball squeezes. You're going to place the ball in between the legs, and then you're going to tell them to squeeze and contract on the ball. And what you're working on is you're working on a really hard contraction of the hamstrings and quadriceps, just to work on muscular strength. The next exercise we're going to do is going to be a play-off of just a regular straight raise. We're going to do a multi-planar. So after doing like a straight leg raise, you have them go on their side, and they're just going to lift their effective leg up as a straight leg raise, but on the side. Just working on strengthening of the hamstring muscles. Make sure this foot's dorsal flex. And then to work the other side. And then you have them just bring the leg up, working on hip abduction as well as adduction. And it's for strengthening. So the next exercise we're going to do for the intermediate stage is going to be a wall squat. We're going to have the athlete firm against the back of the wall so they can use that as support. You're going to have them go down to squat and go ahead and come back up. Just hold it for about 5 to 10 seconds. And it's just working on getting a nice hard contraction to the lower body. Having the wall there also takes a lot of stress off the knee, so it won't hurt or bother them.
Thanks. Appreciate it.
The next exercise we're going to be doing for the intermediate stage is going to be resisted knee extension. You're going to have your athletes start in a standing position, or for safety reasons, if they're feeling unbalanced, you can have them lean against the wall. But you want the knee to start slightly flexed, and then you're going to have them extend against the TheraBand, so go ahead and take it into extension. What this is working on is achieving full range of motion, just working on that extension, which is often lacked after surgery. Alright, the next exercise we're going to do for the intermediate phase is going to be monster walks. You can do them lateral, forwards or backwards. So we're going to have them squat down. The important part is to be squatted down. You're going to go sideways, and then frontwards you're going to have them go out. And then backwards, it's the same thing but backwards. You would start with the lighter colored band, and then as they get more familiar with it, you would increase the darker colored bands to make it more hard. The next exercise we're going to be conducting in the intermediate section is going to be stool pushes and pulls. We're going to have the athlete heel strike out and then pull himself. This is good because it works on the full range of motion as well as giving a hard muscle contraction. And then to counter with flexion, you can have more extension and have them push themselves. So you're still going to have them strike out, and then they're pushing themselves back, kind of forcing that joint into extension, working on getting the full range of motion back as well as strengthening. Alright, so the next exercise we're going to do is the intermediate stage is going to be step up. You're going to have the athlete go up onto the step with their bad leg, and then back down on their good leg. This is good because it's going to give you a eccentric contraction and also an eccentric contraction of the quad, and also reassuring the athlete that it's ready for stairs.
Lateral.
And then we're also going to do lateral. So go ahead and you're going to go up with the bad, and then down with the good. Same thing as doing the regular step up. Alright, so the next exercise we're going to do is going to be a hamstring curl. It's going to be weighted. So you're going to have the athlete sitting prone, and he's going to go ahead and curl his leg. Just working on contracting the hamstring, working on strengthening that, as well as going through range of motion.
The next stage of this rehab process is the advanced stage. In this stage, we will be going from 85% to return to play with unrestricted functional exercise. I will be the clinician and John will be the patient. This next exercise is cutting, working on acceleration and deceleration techniques. The next exercise is 360 lunges. When doing the 360 lunges, it's important to keep your chest up and make sure that your knee does not come over your toes. Side bounds, working on acceleration and deceleration. You're so creepy. Next exercise is ball pickups, working on neuromuscular proprioception. The next exercise is balancing. Tandem on a half of ball. The next exercise is a wall squat with a hold. Now we have the ladder drill, working on some agility.
The next exercise we're going to be doing is going to be resistive defensive slides, working on getting in a defensive position and sliding.
The next exercise is box jumps, doing a little plyometrics. The important thing to remember is to have a soft landing. The next exercise is the leg press, working on strength.
Alright, in this section we're going to be focused on return to play. Most of the exercises are going to be more advanced and more functional in some form of testability to make sure the athlete's ready for competition. Alright, so getting more sport specific, the first exercise we're going to do is just a simple layup, working on explosion up and scoring a basket. Next exercise is going to be called crossover. The athlete's going to run forward, stop at one of the cones, and do a crossover move. It's working on acceleration and deceleration. So the next exercise we're going to be doing is going to be a rebounding drill, working more sport specific, working on the explosion of jumping up to get a rebound at its highest point. I'm going to throw the ball off the glass over here so she knows where it's going, and she's going to jump up and get the rebound at the highest point. Working on explosion and also working on slowing down immediately. The next exercise we're going to be conducting is going to be figure eight dribbling, working on the athlete's ability to dribble as well as change directions. So the next exercise we're going to be doing is going to be called a tandem double dribble. You're going to have the athlete stand tandem on a half roll. We're going to work on dribbling both balls, and it's really just to work on core as well as hand-eye coordination to make sure that the athlete is really ready to return to play. next exercise we're going to be doing is going to be called a pivot exercise. What you're working on is a post move. We're going to give him the ball, he's going to pivot and then shoot a jump shot. So the next exercise we're going to be doing is going to be focusing on the J shot, common post move. So we're going to have the athlete run forward, make a J, and then he's going to get the ball and then pull up and jump off of that. So it's working on acceleration, deceleration with cut. Alright, the next exercise we're going to do is going to be more of a test compared to a baseline, which is going to be done for all the athletes prior to their season. You're going to have them do just a simple jot drill compared to the times earlier that season. If the athlete is able to score scores on the jot drill that resembles their baseline, then you know they're ready to play.
The next test is the curl agility shuttle, and basically you're gonna start in the middle and then run 5 yards either direction, then 10 yards in the opposite direction, and then back to the center. And this test is for agility.
So the next exercise we're going to do is going to be working on balancing. We're going to do a single leg stance on a dyno disc. The athlete's going to bend in a squatted position all the way down, so it's almost like a squat. And then we're going to dribble as well.
Right now!
There's no countdown? What are we calling this one?
God, you came up with
This
it.
is ball squeezes?
I want to punch you in your face.
I want to say episode for some reason.
Next episode.
No! No, you can't!
Alright, the next thing we're going to be doing is going to be working on kind of stabilization, next exercise we're going to be doing is going to be resisted, never mind. The next exercise.
What?
So you're squeezing the ball, okay? You got it.
You said squeeze the ball.
I'll put the ball there. I'll put the ball there.
Let's go.
And this is our Professor Jeff Beer going hard in the paint.
I have nothing to do with
A little noon ball.
Right there. Represent.
Dude's a beast.